Turn back to the pandemic now. Delta variant spreads, as you know, and now new vaccine results are coming in from Moderna just this morning, released just a short time ago. And I spoke with the president of Moderna, Dr. Stephen Hoge, earlier. Take a look. Thank you so much for being here. What is the headline, the new information in terms of efficacy when it comes to the vaccine that you have?
Well, we're happy to share some good news about the vaccine today, which is that through 6 months in our clinical trials, we're seeing durable protection against COVID-19, which is actually really welcome given everything we're facing.
All right.
But there's an important caveat to that,
Go ahead.
Which is that we haven't yet seen the impact of the Delta variant on those numbers. And so we need to remain vigilant.
All right. You're going to keep an eye on this up to 6 months, but it could give some protection even further.
Correct. We'll continue to update this over time. But the durability of that protection through 6 months is really encouraging.
All right, it's encouraging, but the CDC is telling us at least 90%, 93% of the cases we're seeing now of COVID are the Delta variant. So the new information you have, what does that tell us, or does it tell us anything at all about how your vaccine holds up against Delta, which is ripping through the country right now?
That's right. We do know that the vaccine has efficacy and protection against Delta variant right after you receive it. But knowing whether or not that will hold up, for instance, through the winter is not something we have information on right now. And certainly, given what we're seeing with Delta, the way it's ripping through the country and our communities, we need to be vigilant.
Bottom line, how is this vaccine, do you think, holding up against Delta?
Really well. And so right after vaccination, there is some real-world evidence coming out from public health officials showing that our vaccine does protect against Delta. That's the good news. But again, the concern here is, well, how long does that last? Really, the winter season, when everybody comes indoors and starts planning for the holidays, will be the biggest test of that vaccine, which is why we need to be vigilant and careful. And
back to what you were saying about boosters. Tell me where you all stand, because there's been controversy, there's been confusion. We have some places doing it on their own, giving boosters. You have the CDC, FDA telling us one thing, Pfizer saying we'll need a booster. What is you all's opinion on down the road folks needing to get a booster shot?
Well, the decision of whether to deploy a booster really is for public health officials, not us as a company. And what we're going to do is prepare options. But we are preparing options because we think they're needed.
And of course, of interest to a lot of parents. What's the timing now, do you think, we have for possibly getting vaccines ready for children younger than 12?
Our goal is to provide that data to the agency by the fall. By the middle of the fall, so that hopefully by the end of this year, we can be vaccinating the under 12 populations. And
you do have trials and information that you've submitted for vaccines for kids between the ages of 12 and 17, but you're waiting to get the okay. When could that come?
I hope any day now. We have been authorized in Europe and in several other countries, and we're working with the FDA to hopefully achieve that authorization in this country as well.
All right. Well, Stephen Hoge, thank you always for your time here with us, and we will certainly check in with you again. Thanks so much.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.